Hello, everyone. Let me introduce myself. My name is Asako. I'm a certified nutritionist. I'm the founder of Magokoro Wellness, which is my private holistic nutrition practice. I graduated from the National University of Natural Medicine in Portland, Oregon, from the Master of Science in Nutrition program. And I'm a cancer survivor, and I created the Cancer Nutrition Handbook for you. It's available to all the participants. So this talk will focus on nutrition basics for cancer, and it will be divided into three sections. Section 1 will be on preparing for treatment and what foods to start adding into your diet. In section 2, we'll cover some nutritional tips for managing side effects during treatment. And in section 3, we'll go over some recommendations for post-treatment care. First, a disclaimer. The information presented in this document is solely for educational purpose and is not intended to be a substitute for professional medical advice. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition. So I know firsthand how stressful it can be after a diagnosis. Let's stick with simple recipes and for now, focus on adding foods rather than eliminating a lot of the foods you're eating. Like with any new habit, it'll take some time to get used to doing things differently, but I assure you it'll get easier. Let's make it our goal, keep it simple, and focus on adding nutritious foods. For cancer patients, American Cancer Society recommends a diet rich in plant foods. It's not necessary to become 100% plant-based, but I encourage you to include a variety of foods from all food groups that include plenty of plant-based foods. Do your best. Try not to stress. Always be kind and gentle with yourself. So when we talk about cancer, we often hear words like battle and fight. But this is really the time for you to be kind and gentle with yourself. The focus of this talk is on food and nutrition, but that's only one aspect of health. What's equally important is our emotional and mental well being. Just know that it's okay to ask for help. Ask yourself, where do I need support? Is it emotional? Is it practical? Like you need someone to go to the store to pick up groceries or uh, give you a ride to the doctor's appointment. Stay connected with your people. So we can assume that there's an imbalance inside the body when we become ill. Conventional cancer treatment is used to remove the symptoms. A tumor is a symptom. While that's necessary, just removing the symptoms doesn't address the underlying condition. According to American Cancer Society, about 5 to 10% of the cancer cases in the US are genetic, and over 40% of the cases are thought to be linked to modifiable risk factors such as diet and lifestyle. Chronic inflammation and oxidative stress, which is an imbalance of antioxidants and free radicals in the body, are like partners in crime and they create an ideal environment in the body for disease. So it's said that chronic inflammation is at the root of nearly all diseases, and it goes hand in hand with oxidative stress. With cancer, inflammatory and oxidative responses have been associated with growth and spread of the disease. So, nourishing our bodies can help reduce the level of inflammation and oxidative stress and create an environment in the body that is more resistant to disease. Making changes in the way we eat and providing our bodies with necessary nutrients is a good place to start the healing process. So, nourishing ourselves can also help improve our gut and immune health. Approximately 80% of our immune system is in the gut. More nourishment you provide the body, it may help you tolerate the side effects of treatment so that it's less debilitating. It may also make the treatments more effective and help slow down growth and spread of cancer cells. So, where do we start? Decades of research shows that a diet that emphasizes whole foods, including fruits, vegetables, whole grains, legumes, nuts, seeds, spices, and herbs, is associated with decreased risk of cancer. And again, it's not absolutely necessary to be 100% plant based, but making a good portion of what you eat, like 2/3 of your plate, come from plant foods can be beneficial. A balanced diet includes a variety of foods from all food groups, and we'll talk about carbohydrates, proteins, and fats. So, complex carbohydrates include whole grains, fruits, and vegetables. And I encourage you to include colorful foods. Think of a rainbow. Phytonutrients are compounds that give plants their colors and protect them from environmental damage. And they also protect us humans on a cellular level and help reduce inflammation and oxidative stress. Adding more complex carbohydrates will also increase your fiber intake. Fiber is only found in plants, not in animals, and also your vitamins and minerals. If your current diet is low in plant foods and fiber, you may need to start slow and gradually increase the amount. Lightly cooking the veggies make it more digestible if you experience cramping and bloating. Certain fibers called prebiotics are like fertilizers for the friendly bacteria in the gut and help improve our gut health, which is necessary for proper digestion and absorption of nutrients, as well as boosting the immune system. Protein is necessary for maintaining all body functions, including immune function. I recommend that you include some type of protein at every meal. Be sure to include plant sources of protein like soy, beans, peas, whole grains, nuts, seeds. There are studies that suggest that plant proteins lower risk of death from cancer. A diet high in animal proteins, including dairy and meat, on the other hand, is associated with increased risk of recurrence. High levels of iron in animal protein generates more free radicals and can promote inflammation in the body. However, quality animal proteins in moderation can be part of a healthy, balanced diet. Wild fish, like salmon, for example, contains omega 3, which is anti inflammatory. Other fish, like mackerel, sardines, anchovies, and herring, are also rich in omega 3 and low in mercury and make good options for protein. Lean protein also includes poultry and eggs, which are preferred over red meat and processed meats. So, a diet that centers plants are generally lower in fat, which is recommended for cancer patients, but fat is still necessary for energy and absorption of certain nutrients like vitamins A, D, E, and K. Plant sources of fat like nuts, seeds, avocado, olive oil can help reduce inflammation, whereas saturated fats from animal sources and trans fats from highly processed foods are inflammatory. Omega 3 is one of the essential fatty acids that our bodies uh, can't produce, so it needs to come from our diet. Again, fish like salmon, sardines, and anchovies are good sources of omega 3. And any way you can to minimize the stress and keep things simple would be good If you're not on a tight budget, buying pre-cut vegetables can make meal preparation quick and easy, or frozen fruits and veggies and canned foods also come in handy. Batch cooking and preparing multiple meals at once and freezing them will give you more free time throughout the week. Changes in metabolism can occur in the body of someone with cancer. Uh, your bloody your blood sugar may become elevated, which makes your pancreas produce insulin, and increased insulin is linked to tumor growth. Limiting highly processed and refined foods and eating more whole foods is one way to lower your sugar intake. And people ask if it's okay to eat fruit. Yes, natural sugars in fruit is perfectly okay. I recommend eating fruits with whole fruits with fiber over drinking fruit juice, which can spike your blood sugar. As for other natural sugars like honey and maple syrup, they make better options over refined white sugar and artificial sweeteners. But keep in mind that sugar is sugar, so it's best to use in moderation. And protein helps slow the release of sugar too. Another thing that may occur in the body is decrease in protein production. Protein is especially important during an illness to enhance immune function, so it's recommended at every meal. During and after treatment, your body will require even more protein, and we'll talk more about that in sections 2 and 3. Increased triglycerides or stored fat is another change that may occur. Lowering your sugar intake and choosing healthy fats can help lower triglycerides, which is different from cholesterol. But omega 3 from fish and plant sources of fat are recommended for both. High cholesterol is quite common in adults, and when combined with high triglycerides, uh, can lead to more issues, which we want to avoid. So, foods I just mentioned in the last slide, fatty fish like salmon and sardines, nuts like almonds and walnuts, seeds like chia and flax seeds can help lower uh, LDL or bad cholesterol, and fiber from plant foods help excrete excess cholesterol. And these are some additional benefits of eating a plant centered diet: prevent DNA damage and assist with repair, detoxify carcinogens, which is a cancer causing substance, regulate hormones. This is especially important for those who have hormone related cancers, increase energy, cancer fighting nutrients. As you approach the first day of treatment, be sure to increase your fluid intake and stay hydrated, and try to avoid high fat, fried, greasy foods. For home prepared meals, try steaming, poaching, boiling, baking, broiling, roasting, stewing. Your tummy will thank you. This has been section 1, preparing for treatment. Remember to keep things simple, focus on adding nutritious foods, and center plant foods for more fiber, vitamins and minerals, antioxidants, anti inflammatory and anti cancer effects, improve gut health, and reduce inflammation and oxidative stress. And lastly, be kind, gentle, loving, and caring to yourself. This is very important. Thanks for listening. So let's go on to nutrition during treatment, section 2. First, disclaimer. The information presented here is solely for educational purpose. It's not intended to be a substitute for professional medical advice, so please seek the advice of your physician or other qualified health provider with any questions you may have. So during treatment, our goal is to optimize nutrition, prevent malnutrition, and maintain a healthy weight. One of the things patients commonly hear from their doctors as they are about to start treatment is to pack on the calories and pounds and consume high fat foods like ice cream, donuts, and cookies. And I understand that not many foods sound appetizing during treatment. And if you're experiencing severe side effects and the only thing you can stomach is ice cream, it's okay to eat the ice cream. Be flexible during this time and don't be hard on yourself when you end up eating ice cream for dinner. With that said, for a person going through treatment, I recommend nutrient dense foods that are comforting and easy to digest and also increasing proteins and healthy fats. So, this is a recap from section 1. Treatments significantly impact nutritional status. Therefore, it's important to nourish the body with a balanced diet and provide it with necessary nutrients. In section 1, we went over the macronutrients, the carbohydrates, proteins, and fats. I recommend a variety of foods from all food groups. Complex carbohydrates, including fruits, vegetables, and whole grains, contain cancer-fighting nutrients, fiber, and provides us with energy. Quality lean proteins help build and maintain muscle, fight infection, and necessary for wound healing after surgery. Healthy fats like omega-3 from fatty fish and nuts and seeds help with maintaining weight and have anti-inflammatory effects. And in the course of your treatment, if you feel that you need individualized care and additional support, do talk to your doctor about seeing a registered dietitian. So, conventional treatment for cancer typically includes chemotherapy, radiation, surgery, and medication. Some people may experience digestive issues like diarrhea and constipation. Fiber is normally recommended in moderation if you have diarrhea, and more if you are constipated, but too much fiber can create discomfort. Cooking the veggies, peeling the skin of fruits and vegetables, blending solid foods, making a puree may be helpful. Some folks may need to restrict raw and unpasteurized foods and avoid exposure to bacteria, uh, especially if they have a low white blood cell count. And depending on the type of cancer and the treatment, some folks may have trouble absorbing nutrients and may need digestive enzymes. And always consult your doctor before taking any supplements. And generally, during treatment, your body will require extra protein due to tissue breakdown, stress on immune system, and risk of undernutrition. So, one of the common side effects during treatment is loss of appetite. Try to get most calories and nutrients when your appetite is at its best. For most people, it's during breakfast time. And eating small amounts of food multiple times throughout the day seems to work for many patients instead of eating 3 large meals. And limit fluids with meals as it can fill you up. Drink beverages between meals when you're not eating. Keep nutritious snacks readily available and within reach. It's good to have foods that you can eat right away when you have more appetite. When you're out and about, keep some snacks on you, like some nuts or tangerines or whatever that's easy to throw in your bag to take with you. You may want to schedule meal times, set an alarm if necessary, so that you are eating every 2 to 3 hours. A nutritional supplement like a protein powder can provide essential nutrients. A homemade protein smoothie or shake will be a good addition. Herbal tea with any one of the following can help improve appetite: ginger, mint, anise, fennel, cinnamon, parsley, and turmeric. And be sure to take a look at the handbook for tips on managing other side effects. So, some patients complain about treatments affecting their taste buds and losing interest in eating. Here's a method to enhance flavors using a few simple ingredients. Remember FASS, FASS, fat, acid, salt, and sweet. So 1 to 2 tablespoons of olive oil can add extra calories, and combined with lemon and sea salt can bring out the flavors of your dish. And if you need a sweetener, try a little honey. Just a simple tip for you. So antioxidants during treatment. This has been a controversial issue in oncology because there's been conflicting information regarding therapeutic use of antioxidants during treatment. Antioxidants protect healthy cells, and for this reason, it was believed uh, to also protect cancer cells from chemo and radiation. The recent studies suggest that antioxidants can increase efficacy of chemo and survival times in patients. And again, please do consult your doctor before using supplements as it may interfere with medications. What about antioxidants from food? Dietary antioxidants are associated with lower mortality or recurrence. So, as we discussed in section one, colorful foods with phytonutrients help protect us humans on a cellular level and help reduce inflammation and oxidative stress. Keep including a variety of colorful fruits and vegetables in your diet as much as you can. Patients with advanced cancer may require additional modifications. Some patients may experience severe and rapid weight loss. When a person loses up to 10% or more of their body weight, it can lead to a condition called cachexia, which is often combined with anorexia and fatigue, and highly associated with cancers of the pancreas, esophagus, stomach, lung, liver, and bowel. These patients will need support and monitoring by a registered dietitian who specializes in oncology. If you have been diagnosed with advanced stage, even if you don't have symptoms, it's still a good idea to work with a dietitian because you can have pre cachexia and not have any obvious symptoms. So, nutritional evaluation is highly recommended. So, this was section two, nutrition during treatment. Remember, we want to optimize nutrition, focus on nutrient dense foods, but be flexible. It's okay if you just end up eating ice cream for dinner sometimes. Stay connected with your team and be kind, gentle, loving, and caring to yourself. And check in with yourself and identify what it is that you need, and know that it's okay to ask for help anytime. Thank you for listening. Okay, section 3, after treatment. But first, a disclaimer. The information presented here is solely for educational purpose and it's not intended to be a substitute for professional medical advice. So please seek the advice of your physician or other qualified health provider with any questions you may have. So, for those of you who are now done with treatment, congratulations. You may be wondering, where do I go from here? So, while our focus is on food and nutrition, again, it's just one aspect of health. I think a holistic approach to healing is very important, which not only looks at the body, but cares for you, the whole person, and looks at all areas of your life that impacts your health and well-being. So, working with providers who treat patients with a whole person approach with respect, compassion, and empathy is essential. As for nutrition, we've been talking about the importance of nourishing our bodies to start our healing process. And now we're going to discuss the next steps for post treatment care. Continue to center plant foods and make a lot of what you eat come from plants while, I'm sorry, which will change the environment in your body, making it more resistant to disease and continue to include more quality lean proteins and healthy fats like omega 3 to support your healing. And do your best and always be kind and gentle with yourself. So, treating the symptoms of a disease isn't enough. If we ignore what the body is asking for and don't give it what it requires, we can't start to heal. Conventional cancer treatment is very hard on the body and significantly impact our nutritional status. So, again, there's no reason to eliminate all the foods you enjoy. If your diet is too restrictive, uh, it can create more stress. And I would rather have you enjoy meals with your family and loved ones than eating by yourself in isolation. So remember, we talked about keeping things simple and focusing on adding nutritious foods. By adding more plant foods, slowly we start to change the internal environment by reducing inflammation, oxidative stress, improving our gut and immune health, and flooding the body with antioxidants and cancer fighting nutrients, and continue to include more proteins to repair tissues, promote healing, and for proper functioning of our body. Along with healthy fats, particularly omega 3s, for its anti inflammatory effects. And at the end of this section, I'll talk a little bit about some lifestyle changes that promote wellness. So, what foods are associated with increased risk of disease? And I've already mentioned some of these, like red and processed meats, saturated fats from animal sources, and trans fats from highly processed foods. Others include fried, grilled, charred foods, and certain chemicals like pesticides, artificial ingredients, food coloring, and also chlorine and other harmful substances in our drinking water. Should you go organic? Going 100% organic is not an option for everybody. It can be expensive. Experts agree that eating a variety of fruits and vegetables, even if they are not organic, is better than not eating them because of possible exposure to pesticides. So you can minimize your exposure by knowing which fruits and vegetables have the most pesticide residue, which are listed on the Dirty Dozen. I usually buy organic for uh, what's on the Dirty Dozen, and whatever that has skin that can be peeled, or like bananas, or have thick skin like pineapples. I buy non organic. Clean 15 lists produce with the least pesticide residue. Both of these lists can be found on the EWG website, ewg.org. You can also find the link in the handbook at the end under resources. Long-term effects of GMO or genetically modified foods on human health is not yet clear, and there's been conflicting information. GM foods are produced in a method that's unnatural, with a goal of producing crops that are resistant to damage and tolerant of chemicals. So, common GMO crops in the US include corn, soybean, potato, summer squash, alfalfa, canola oil, um, etc. So, like what's on the Dirty Dozen, I try to buy organic for these foods, but do your best. Okay, I've already mentioned this, but buying what's in season not only saves you money, um, but fresh seasonal produce has more nutritional value. If you're including animal products, grass fed, pasture raised, wild caught, and organic products may be better options for their nutrient content and higher standards. So, for example, not using antibiotics and synthetic growth hormones for meat and dairy. There's also traces of antibiotics in farmed fish, as well as more contaminants compared to wild fish. So prices tend to be higher for naturally raised animal products, but they're recommended to be consumed in moderation. And if you don't already, start looking at the ingredients on food packages. My own rule is to avoid ingredients that I don't recognize, including products with a long list of ingredients. With packaged foods, fewer ingredients, the better, and know what's in it. Oftentimes, there are artificial ingredients which can disrupt your gut health and promote inflammation. So, these are just few of my favorite cancer fighting foods. Cruciferous vegetables include cabbage, broccoli, cauliflower, bok choy, green leafy vegetables. These vegetables in the cabbage family contain powerful anti-cancer properties and especially good for patients with estrogen dominant cancers, including breast cancer. They help stabilize estrogen levels, and the fiber is also good for our gut. And optimizing our gut health is key to balancing hormones. Mushrooms. In Asia, certain mushrooms are used to complement cancer treatments and also to treat infections and other diseases. There are medicinal mushrooms like reishi and turkey tail, which come as supplements, and those are found in health food stores here. Edible mushrooms like shiitake, for example, can be found in regular grocery stores. They're anti inflammatory, antiviral, and stimulate the immune system. Recent studies have shown that higher mushroom consumption is associated with a decreased risk of cancer, making them a great addition to your anti-cancer diet. And I always have frozen berries in the freezer and put them in oatmeal or in smoothies. Remember, add more colors to your diet for cancer fighting nutrients that protect you on a cellular level. Berries are high in antioxidants that scavenge free radicals and interfere with the development of cancer. And I already mentioned green leafy vegetables. Many are cruciferous vegetables belonging to the cabbage family. They are rich in vitamins A, C, E, K, and B vitamins. And green tea is known to help block the formation of cancer-causing compounds and in the body and also prevent the formation of new blood vessels needed for tumor growth. It contains caffeine, but it's different from coffee and has more of a calming effect. It's more gentle on our gut and can also help reduce estrogen dominance and lower estrogen levels. So, spices have been used for thousands of years for their flavor, taste, and wonderful colors. And these colorful spices have also been used as medicine around the world for their high antioxidant, anti inflammatory, and immune enhancing effects. Curcumin, a compound found in turmeric, has been extensively studied and received attention for its potential therapeutic use in prevention of cancer. With the spice turmeric, adding a little oil and black pepper will enhance the absorption of curcumin in the bloodstream. Fresh ginger and garlic are available everywhere and can be added to a variety of recipes. They're particularly good for the digestive system and associated with reduced risk of colorectal cancer. Others like onion and scallion, clove, coriander, cinnamon, red chili pepper, and fennel were also noted for their anti-cancer effects, inhibiting tumor development and spread of cancer cells. And some spices help with balancing hormones, which are especially beneficial for breast and prostate cancer. Studies have shown that certain spices make cancer cells more sensitive to chemo and radiation therapy. So, nutrients we need to function should come from food first. And for additional and necessary support, we can consider dietary supplements when there's a deficiency or for a therapeutic purpose. Um, Dietary supplements are called just that because they are meant to supplement the diet, not replace it or counteract poor diet. So, another thing to keep in mind is that dietary supplements in the US do not have to be approved by the FDA, the Food and Drug Administration, before they are sold on the market. So, for anyone recovering from cancer, I recommend that you consult your physician first or a registered dietitian who specializes in oncology, and they can provide individualized recommendations based on your lab work and recommend professional grade, high quality products. And if you have a naturopathic doctor or Chinese medicine doctor, they can recommend herbal supplements for therapeutic use. You definitely want to consult your doctor first to be sure that it's safe and avoid drug interactions and potential side effects. And with that said, here are some supplements that can support your overall health. Curcumin from turmeric can come from food, but supplements have higher dosage and use for their high antioxidant content and to reduce inflammation. Omega 3 can also come from eating fatty fish like salmon, sardines, and mackerel a couple times a week, and also from seaweed, soybeans, walnuts, and flax seeds. But again, supplements have higher dosage and used to reduce inflammation, lower triglycerides and blood pressure, raise good cholesterol HDL, which helps lower bad cholesterol LDL. And omega 3 is also associated with improved brain health and enhanced mood. Vitamin D is especially important for us living up here in the Pacific Northwest where we don't get much sunshine. Vitamin D is important for immune health, for our bones, for our brain health. Studies have shown association between poor vitamin D status and increased risk of developing colorectal and breast cancer. So, certain foods contain vitamin D, like salmon, mushrooms. There are products fortified with vitamin D, but it's actually difficult to get enough from food sources. So, supplementation is usually recommended for vitamin D. You can take too much, so having your levels checked is important. Probiotics for healthy gut also help strengthen the immune system, improves digestion and absorption of nutrients. The gut is often referred to as our second brain. So, healthy gut can lessen symptoms of anxiety and depression, including fermented foods like yogurt will be really good. Um, I like unsweetened non-dairy yogurt made from nuts, and I eat it with fruit or put it in a smoothie. So while there's need for further research, numerous studies have shown the benefits of medicinal mushrooms in integrative cancer care, in reducing side effects of treatment and improving quality of life, positive effects on anti-tumor activity and increased activity of natural killer cells, which are immune cells that go after abnormal cells, were reported. And I put a scoop of it in smoothies. Shiitake mushrooms are available for at most grocery stores. So I talked about the importance of a holistic, whole person approach to wellness, which takes the mind, body, and spirit into consideration. And we've been talking about nourishment of the body with food and nutrition. I also encourage joyful movement of the body. This can be any kind of movement as long as you enjoy it. I find physical activities you like, Tai Chi, Qigong, yoga, walking, dancing, moving the body in a way that feels good helps heal the body. It can help balance blood sugar, hormones, reduce inflammation, improve immune function, increase survival rate, and help relieve stress and anxiety. And resting and getting plenty of sleep and self care practices for stress relief, which is a whole nother presentation. Chronic stress can lead to a number of health issues, including chronic inflammation and weakened immune system. So, something as simple as taking deep breaths can be really helpful. Um, Inhale through the nose, hold, exhale through the mouth, and count your breaths and do this several times and um, notice how you feel. So, whatever it is that helps you relax and relieve stress, it should be a part of your daily activity. Um, it can be anything, like being outside in nature, making art, listening to music, watching a movie, a comedy, reading a novel, and journaling. So I encourage you to try new things. In my own healing, I'm now paying closer attention to how I feel in my heart and in my mind with the help from a therapist. It's an ongoing journey. Stay connected with your people and don't hesitate to ask for support from your loved ones and from professionals. So, this concludes our presentation. In section 3, we discussed changing the internal environment of the body with a diet rich in plants, fiber, antioxidants, phytonutrients, and improving our gut health and reducing inflammation and oxidative stress. What I hope for you to take away is that it's not just about going on a temporary diet, but more about making lifelong changes, not only in the way we eat, but the way we care for ourselves. So, um, yeah, health is multidimensional, meaning it's not just about absence of disease, but it also includes our emotional, mental, and spiritual well being, which are all connected. Healing takes time, and you don't need to do everything. We talked about all at once, set small, achievable goals, and over time, the small changes can have a big impact. Slow down, get plenty of rest, make time for whatever it is that you enjoy. Positive emotions strengthen the immune system. So be open to receiving help and always be loving and caring to yourself. Thank you all for listening.